It is with a heavy heart that I inform you all that I have a rare and severe bone infection called osteomyelitis in my right SC joint. What I know as of right now, it's formed 4 abscesses, which you can see right here, a few of them, 3 of which are around the size of a golf ball, and the largest one is inside my chest cavity. As my bone and surrounding tissues continue to die, those abscesses continue to grow larger. I am praying that it's only in this one area of my body, but I do not know yet. I am scheduled to undergo a major surgery this Friday where they're going in and they're removing my entire right SC joint and the surrounding dead bone and tissue. The treatment and recovery for this is going to be long and intense. And I'm here not only to inform you of what's going on, but also to humbly ask for help. The surgery, the treatment plan, the medications, the at-home care, the loss of work, the follow-up visits, the imaging, everything is astronomically expensive. And if you can afford to do so, please consider donating to my GoFundMe, which my link is in my bio. I know my purpose on this planet is to give back and to help others. I've been doing so through my advocacy and inclusion work for years. However, I can't continue to give back to the world at the scale of which I'd like to if I myself am not healthy enough to do so. So I'd be forever grateful if you could donate or share this far and wide. Now, I know a lot of you probably have a ton of questions, and I'm going to try and answer some of what you may be thinking about right now. When did this start? How did this happen? Does it hurt? How rare is osteomyelitis in the SC joint? What does surgery and recovery look like? Am I ever going to play sports again or lift weights? And, how is this going to affect the rest of my life? So it's a lot of questions, and I'm going to try and get through some of those without too many tears. I may break down, and that's fine. That's okay. I'm breaking down a lot lately, and it's taken me a week just to do this video. So when did this start and how did this happen? Well, I'm not exactly 100% sure. As many of you may know, I suffer from a disorder called chronic myofascial pain syndrome. With this disorder, lots of random things happen all the time, from different flare-ups to random things happening in my body. And back in January, I started to notice 2 smaller lumps. They weren't this big at the time, around my right SC joint. And I just thought, oh, my disorder flared up and it's something weird and it's, painful and whatnot, but it's going to go away. And so I gave it a couple months and it didn't go away. And by that point, I thought, well, maybe it's a partially dislocated SC joint. Again, a couple months went by and they just continued to grow. And so I decided I have to seek out help. I was first referred to a chiropractor, and I am forever grateful I did. I think fate brought her into my life. She did some examinations, we did x-rays, and everything came back normal in my SC joint. There was no dislocation at all. Everything was in alignment. The radiologist and other doctors and herself discussed my case based off of all the symptoms I was having, and the examinations and the x-rays. They decided an MRI is warranted because they feared that it could be one of 2 worst case scenarios, either lymphoma or osteomyelitis. I went and had an MRI done, and the MRI results came back that I do in fact have severe osteomyelitis in and around my right SC joint. Now, does it hurt? Yes, it does hurt. It doesn't hurt excruciating bad all the time, but when it's flared up, my entire SC joint area around my neck, on the side of my neck, is red and inflamed. I lose all mobility in my right arm. I can't change my shirt, can't move my head, I can't move my arm, and it hurts to breathe, it hurts to swallow. However, the majority of the time, it's under control, and it is just this weird pressure that I feel in my chest and a low pain. So I'm still able to be more mobile and do some of my normal activities. However, I'm also a lot more fatigued and don't have as much energy or strength to do my normal routine. So how rare is osteomyelitis in the SC joint? It's actually extremely rare. Osteomyelitis is, just regular osteomyelitis is about as rare as lymphoma. They say, I think, around 200,000 patients get it a year. However, osteomyelitis in the SC joint is much more rare than the most common forms of osteomyelitis. From a 2014 scientific journal, they said that there was 225 documented cases of osteomyelitis in the SC joint from the previous 45 years. So I'm one of hundreds, apparently, who have this unfortunate incident. Now, most of the time, like I said, osteomyelitis forms in different areas of the body, like in the long bones of the arm or the leg, and other parts, not in the SC joint. They aren't exactly sure what was the cause of this. As I said, osteomyelitis is an infection of the bone. So it could be from a bacterial infection, but it also could be from arthritis. And my cardiothoracic surgeon, who reviewed my MRI with me earlier this week, said that yes, my case is extremely severe, and the only option is surgical removal of the entire area, which was the worst case scenario. And I was praying it wasn't the case, because I didn't want to lose my right SC joint. I didn't want to lose my mobility, and I have no idea what that means for the rest of my life. However, so surgery, and what does surgery and treatment look like? Like I said, they're going to go in, they're going to remove the entire SC joint and the surrounding dead bone and tissue. They're not going to put an implant or a bone graft for myself, because the area is poorly vascularized. And that means that not enough oxygen will get there to support a bone graft or an implant. So it could cause more problems. So basically, they're going in, blowing this up, taking it out, and there's going to be a giant hole in my chest until it heals. And over time, my sternum and my clavicle will grow back together, and they will fuse. So I will lose this joint, I will lose that mobility for the rest of my life, but the bones will eventually grow together. Now, after surgery, I'm going to have what's called a wound vac attached to my chest, with tubes coming out to drain the fluids into this little carrying case that I'm going to have with me all the time for 1 to 3 months, however long it takes for the wound to close up and heal. I'm also going to have a at-home nurse every 3 days for as long as that takes until my wound's healed. I'm going to have countless follow-up appointments, imaging. I'm going to be on heavy antibiotics and pain meds. If my tests come back that it was a bacterial infection, or there is indeed a bacteria in there right now, I will be on heavy IV antibiotics from either 6 weeks up to 6 months. Osteomyelitis is known to become chronic in a lot of patients, and I'm praying that I'm not one of those people. I'm going to stay positive with that. So this could be a very long battle, but it's one that I am determined to win. So people may wonder, how's this going to affect the rest of my life? That's a question that has a lot of uncertainty for me, and I don't really know the answer to that. But I've been through a lot in my life, and I'm determined to not let this stop me. I'm not going to quit. This is just another challenge that I have to go through, and that I'm going to conquer. People ask, am I ever going to be able to compete in sports at the high level that I like to compete in, or lift weights? I don't know. My doctors and surgeons have all told me that the SC joint isn't absolutely crucial to a lot of mobility, but it is crucial for some mobility in my upper body. So I'm probably going to have to relearn how to do things. I'm going to have to relearn how to just move my right arm in certain areas. I don't know if I'll ever be able to play volleyball at the level that I play. I don't know if I'm ever going to be able to lift weights the way I do. I don't know if I'm going to be able to be as active as I once was. And as many of you know, my athlete identity is one of my core identities. And playing football for the University of Nebraska as an openly gay Husker back, in the early 2000s, and then having that career-ending spinal fusion was incredibly rough. So I've already been through something like this in my life, where I thought sports was taken away from me for the rest of my life. And after my spinal fusion, I lived in fear for over a decade of what I could and couldn't do, based off of what doctors, friends, and family said that my capabilities were because of my bad back. And then years later, I developed this chronic myofascial pain disorder, and it was just another hurdle. But I have defied all those odds. I've done this before. I have to do it different. My body's different than everyone else's. I'm going to have to relearn how to do a lot of things, but I'm determined to learn how to. I'm going to defy the odds again, and I'm not going to give up. I've been through far too much in my life, from overcoming abuse, near suicide, an eating disorder, countless other traumatic things. And like I said, from my spinal fusion to this chronic myofascial pain syndrome, and now to this other huge, immense challenge in my life. I will conquer this, and this will just be another inspiring chapter for my book someday. And just another way that I can help inspire others to realize that they can do anything and they can overcome the odds. Yes, it's going to be hard. And yes, I'm scared. Incredibly scared. But I'm going to stay positive and I'm going to fight. Because that's who I am. I'm a fighter. I always have been, I always will be. And I'm going to win. I'm going to win. So I thank you all for your love and your support. I know there's a lot of messages being sent to me, and I can't respond to the majority of those, and I apologize. But no, I see them, and know they mean the world to me. I'm quite overwhelmed right now, and I will respond in time and do my best to respond. Follow along my journey on social media. I'm going to continue posting things as I recover, and yeah, I can't do this without you. So please consider donating to the GoFundMe. Please share this with your friends and family and your social networks, because I can't do this alone. And this is the one big time in my life where I have to put my Leo pride aside and ask for help. So thank you all. Much love. I'll see you on the other side.